and welcome to Health Q channel, the health awareness channel where my mission is to motivate you to look at the brighter side of the health. First of all, I would like to thank you all from the bottom of my heart for helping me out to reach to this major milestone of my life, and that is 1 lakh subscribers. This was not at all possible without your love and support. Thank you so much for being there for me. I promise you today that HealthQ will constantly work to bring some informative content that would be helpful and will motivate you to look at the bright side of the health. And for that, please keep loving me and showing your support to this channel. Today, we are going to talk about a different topic, and that is Parkinson's disease. This has been a long requested video, and that's why it's high time that I create a video on it. Parkinson's disease, what exactly it is, why it happens, how it is diagnosed, and what is the strategy of management, what are the possible surgeries, treatment options that are available. We are going to discuss about all of them in today's video. So make sure to watch this video till the end. Let's begin. Friends, Parkinson's disease is a brain disorder. It's a condition that leads to shaking legs, stiffness in body, tremors, difficulty in walking, standing, and loss of balance and coordination. Now, basically in Parkinson's disease, the neurons or else the nerve cells lies in the area of brain that controls the movement becomes impaired or else damaged, following the disease which is called as Parkinson's disease. Till date, why this entire disease happens have not been found out. But there are many predisposing factors that could lead to Parkinson's disease. And one such factor is hereditary, and the second factor is genetic disorder. But Parkinson's disease, along with genetics or else hereditary disease, also is commonly seen with people who have lived a stressful lifestyle. In a normal scenario, the neuron will produce an important chemical in the brain which is called as dopamine. Lack of dopamine to an adequate extent leads to problem with movement. There is also loss of the nerve endings that also produce another chemical which is called as norepinephrine. Norepinephrine is a main chemical messenger of sympathetic nervous system which controls many automatic functions of our body such as heart rate, blood pressure, and leads to fatigue, irregular blood pressure, decreased movements, tremors, which would be very predominantly seen in hands, arms, legs and jaw. There would be stiffness, especially seen in limbs and trunk. Movement becomes drastically slow. There's lack of balance and coordination which gradually increases and leads to a lot of fault-related issues in elderly. And some other complications also develop in Parkinson's disease which are like depression, difficulty in swallowing, difficulty in breathing, difficulty in chewing, difficulty in speaking and expressing, urinary problems, constipation, skin problems, and sleep disruption. Mostly, Parkinson's disease is diagnosed with the help of medical history and neurological examination. Coming to the management, mostly the management is medical. Medicines are very important, and medicines basically focuses on delaying the disease process. Unfortunately, Parkinson's disease is not a curable problem. But the entire aim of management of Parkinson's disease is to delay the problem and allow the patient to live a good and healthy lifestyle. Mostly medicines are given with the aim to increase the level of dopamine in brain, control non-motor symptoms. Medicines to mimic the role of dopamine in the brain. Medicines are given to slow down the enzyme that breaks down the dopamine in the brain. Medicines are also given to reduce tremor and rigidity. Now, these medicines also come with its own side effects, and that's why it's very important that people with Parkinson's disease should never stop taking medication without doctor's instruction, because these medicines can cause or else give you a lot of side effects if you stop it without experts' advice. And you should take, how much you should take, these things has to be very precise, and that's why self-medication is not at all advisable in Parkinson's disease case. The second treatment option when it comes to Parkinson's disease management is deep brain stimulation. People mostly who do not respond to the medical management are given or is kept in this second group of treatment, which is deep brain stimulation. This is a surgical procedure in which implants are placed into the part of brain which connects them to a small device which is implanted in chest. This device painlessly stimulates the brain in a way that helps stop making any of the movement-related symptoms. Other treatment modalities which are used are physiotherapy, occupational therapy, speech therapy, psychotherapy, and health and diet modification. Now, this was about the possible treatment options. Now, when it comes to the strategy of managing Parkinson's disease, it has to be absolutely a team approach. There is an involvement of not only neurologists but other healthcare professionals as well as the caregiver or his family member in order to plan and execute the treatment plan. The treatment should mostly aim at long-term control of symptoms and improving quality of life. One thing as a Parkinson's disease family member or as patient of Parkinson's disease should be aware of is that this problem is not curable, but the aim of treatment or management is to improve the quality of life and minimize the symptoms as much as possible. Parkinson's disease is a progressive disease and treatment will definitely improve the symptoms but will not cure the symptoms. Hence, it's very important at this point of time to be realistically optimistic. Friends, when it comes to physical management or its physiotherapy management, the focus is to reduce or else concentrate on reducing the physical manifestation of the disease. The aim of physiotherapy treatment is to improve and maintain the functional independence of the patient, to improve the mobility of the patient, to correct and improve the movement patterns and posture of the patient, to maximize muscle strength and flexibility, to correct and improve posture, balance, and to minimize the risk of fall. The focus is also on maintaining a good health and well-being of the person, improving breathing pattern, and teaching patient to cough effectively. The management also focuses on improving or else modifying the house in a way that is ergonomically useful for the patient to enhance the effectiveness of drug therapy. So, what's included in physiotherapy management? Well, physiotherapy management mostly comprises of exercises, functional movement training with the help of technology, and gait training. Exercises usually is the mix of range of motion activity, gentle stretches, strengthening exercises, coordination exercises, balance exercises, aerobic activity, aquatic exercises, and progressive resisted training. When it comes to functional movement training, the aim is to teach patient to come up with certain movement strategies that patient can apply in his day-to-day lifestyle. All the functional tasks that a person needs to do on a day-to-day basis is first identified, and then the exercises are designed to teach the patient how to modify the movement or else how to optimize the movement in a way that the movement can be performed in best possible way without having any other injuries or difficulty of doing movement. When it comes to movement training with the help of technology, virtual reality is very helpful in teaching patients to do activities which are helpful, especially in terms of fine motor like writing, using of cell phones, clicking activities, and most of the activities that have use of fingers or toes. Gait training basically focuses on improving the balancing ability and teaching patient the fall prevention strategy. As Parkinson's disease patient is at higher risk of fall, and that's why fall needs to be prevented as much as possible so that other secondary musculoskeletal complications like fracture, arthritis, or any kind of joint or muscle related pain can be avoided. Friends, again, when it comes to Parkinson's disease, it's not that if it is not curable, that doesn't mean that you cannot do anything about it. Every problem has a solution. Yes. Here also the solution lies in looking at the brighter side, looking or is focusing on the things that you can do in order to improve your quality of life, in order to reduce the level of symptoms and live your life in the best possible way. The aim of physiotherapy management, or be it any type of therapy, is to help you to achieve those goals. So please don't get disheartened. I would again tell you, be realistically optimistic and constantly keep on working towards your health. I hope you found this video informative. If yes, make sure to like this video, share this video with whom you feel this video would help, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.